Hi, everyone. I hope you enjoyed your first session thus far. We are going to start with a short presentation and just an introduction. My name is Afreen, and I am serving as the Professional Issues and Ethics Committee Chair for District 2 this year. I'm going to go ahead and share my screen, and I will have my colleagues introduce themselves.
Hi, everyone. My name is Regina. I'm a D3 at Buffalo, and I'm one of the associates on Afreen's committee.
Hi, everyone. I'm Colleen. I'm also on Afreen committee, and I'm a D2 at Columbia.
All right, wonderful. Just gonna put this on. So like Michelle said, hopefully this will be one of the most engaging parts of today, and hopefully you'll enjoy it. Just a brief introduction to ethics. So ethics are principles that require all actions, including decisions by dentists that demonstrate patient autonomy, non-maleficence, beneficence, justice, and veracity. And a couple housekeeping rules here. Just want to reiterate that this is a safe space, so any sort of discussions you have both within the breakout sessions and when we reconvene in groups will be listened to and respected. When you enter your breakout sessions, please begin your group discussions by introducing yourself, your school, something you'd like to share with the group. And each group will have an assigned facilitator, and this will just be to help guide questions. They will introduce themselves as such. And every group will have 4 minutes to discuss the topic at hand. And please designate a spokesperson to represent your group. And once we come back and reconvene in a larger group format, we can have the spokesperson share what you guys talked about in your groups. And with that, I will go ahead and start introducing one of the 4 topics we'll be talking about. The first is vaccinations. So vaccinations, as we know, very hot topic these days, and it is the connection between oral and systemic health. As it strengthens, it is important for dental students to understand how vaccines play a role in stopping communicable diseases. And dental students and dentists play a vital role in explaining evidence-based medicine to patients and advocates of the anti-vaccine movement. So the American Dental Association supports compliance with the current Center for Disease Control, the CDC, and prevention guidelines for vaccines. ASDA recommends that dental students and dental schools urge patients to follow CDC guidelines for vaccines. And ASDA encourages dental schools to provide patient education on vaccines as a scientifically proven and safe and effective measure of preventing communicable diseases. A couple of myths or misconceptions about vaccines. Vaccines cause autism, which according to the CDC study shows that there is no relationship between vaccines and autism. Another myth that we have out there is vaccines may cause harmful side effects and illnesses. Once again, the CDC ensures that vaccines are in fact very safe and effective through various studies. Side effects usually are mild and include soreness at the injection site or low-grade fever. Another myth, majority of people who get diseases have been vaccinated. So the United States Department of Health and Human Services reports that vaccines are safe and effective because vaccines are held to a very high standard of safety. And another myth, finally, vaccine preventable illnesses have been eliminated, so there is no need to be vaccinated. And according to the CDC, vaccines not only protect the person who gets the disease, but also keeps the infectious disease from spreading onto others. And vaccines do not overload the immune system, but instead they're a way to immunize against infections and disease. Some facts about vaccines. Vaccines are made from small amounts of weak or dead viruses, bacteria, or toxins. And immunization is the process of being immune to an infectious disease. Immunity is the body's way of preventing the disease. Vaccines have greatly reduced or eliminated many infectious diseases that once routinely harmed or killed, but the source of the disease still exists. So vaccines are necessary to prevent infants, children, and adults from getting many infectious diseases. And I'm sure this is quite a hot topic and something that's been discussed pretty widely with the current state of pandemic we're in. And CDC reports that vaccines have prevented more than 21 million hospitalizations and 732,000 deaths in the last 20 years. And the role of dentists in vaccinations is that in May of 2019, Governor Kate Brown signed a bill into law that allows dentists to administer flu shots and other vaccines to their patients, making Oregon the first state in the country to do so. And currently, Illinois and Minnesota dentists can provide flu shots to adult patients. The measure is set to further solidify the relationship between oral health and overall health, according to an ADA News article publication in April of 2019. And any dentist who wishes to vaccinate patients must take a continuing education course and meet state guidelines to report and store vaccines. Providers would also need a complete vaccination history from each patient to administer these appropriate vaccines and follow the recommended timelines. So that is one of the 4 topics we will be discussing. With that, I will hand it over to my colleague.
So I can cover licensure. So basically, dental licensure is how we all actually become dentists. You know, in the United States, it's very different from state to state, and we'll briefly discuss all of these. But you need to have graduated from a CODA accredited school, and you've probably heard your administration talk about this. We're getting CODA recertified this year. You need your written exams, NBD parts 1 or 2, and as we know, it's getting combined to the INBD. And shameless plug, if you want to learn more about that, you can visit asadistrict2.com/events. And then clinical examinations. So if we want to move on, we can just briefly talk about different forms of licensure. So traditionally, you know, you have a clinical exam. Are you actually good enough to treat a real patient in real life? This is administered depending on what state you want to get licensed in, but CDCA really takes a lot of the Northeast, and they administer the ADEX. So the ADEX is made up of a few different parts, but you will get clinically affected, make sure that everything is okay there. You have your SIF type in examination, and if you attend the next session with Dr. Gambacorta and Dr. Perkins, they're going to talk about all the pathways to licensure, how it differs in each state, and how COVID specifically has changed and made permanent changes going forward in the licensure for each state. So in the SIF, it's basically like you're not in one single setting. Everything is dependent on how you perform. You do a lot more mannequin-based exams, and you can always seek remediation. So some places, for example, New York and Delaware, require PGY1. There's other states that will take it, but New York and Delaware, if you plan on practicing there, you have to do 1 year post-grad. So it's basically just a residency program. If you want to do be a general dentist in AAGD or a GPR, or any type of other specialty will waive this requirement because it's more than 1 year of specialty. So it kind of really depends on the state, but for New York, and I know a lot of us here on this meeting, we're representing the District 2 schools from New York and New Jersey, so that might be a lot of us. California, they have a portfolio examination, which is pretty cool because students can record their work over time and send it in to get feedback and kind of get real life updates on how their performance is. So for non-patient-based alternatives, you've probably heard at least the term thrown around, the DLOSCI. Also, if you want to hear more about it, check out our previous recordings. But the DLOSCI is a fairly new exam, and it has really helped out this year with COVID and students saying, oh my gosh, I can't get licensed, what do I do? So it was developed by the Joint Commission on National Dental Examinations, which are the same ones that make national boards, and really has just like been another way for students to seek a form of licensure. So current issues are that your friends in like other healthcare professions probably don't have to take a live patient examination in order to get licensed. It's unethical, it lacks validity. There's so much research that says it really like doesn't do anything. So many exam failures are just linked to patients not getting standard treatment. And, you know, it's a high pressure situation. You're saying, I have to pass this exam right now. I'm paying money for it. This is how I'm going to get licensed. You're not in your right headspace to think. It lacks validity. A bunch of deans say it's not even like an accurate representation of the student skills. It lacks reliability too. And saying a lot of students who otherwise would have passed or vice versa on the day of with all the pressure don't. Finally, unethical behavior. If you've talked to any graduating D4s at your school, not this year, but in previous years, they've probably talked about this behavior going on by saying, you know, I really want to do this patient's filling right now, but I need a class 2 for licensure. So I'm just going to ask them, can we wait for a few months and put off their filling? Now, that's not really right for the patient. If you see an active disease process in their mouth, you see periodontitis and you need to do scaling and root planning, 4 quadrants, you really shouldn't have to ask them to put off their own health so you can get licensed to practice dentistry. It's a one shot, it's high stakes. People say it's like the worst day, most stressful day of their lives. And you know, it's also just inhumane treatment of the patients by saying there's so many businesses that are, we'll find a patient for you, but you have to pay us. I know people who have had to pay patients so that they actually show up that day, because if they don't show up, you lose your money. I also have heard that some people will go and try to poach your patients and say, I'll pay you more money. And this whole thing is just something that should not be happening. It doesn't encourage the best for our profession and make sure that we're getting the best and brightest. And you can see right there, I'm not going to read it all to you, but a lot of people feel that students prematurely treated a lesion. That's another thing. Oh, well, you know, the cavity really isn't there. It's more of like an incipient lesion, but it can probably pass. And that sounds great. So let's treat something that in reality, you'd probably just monitor over time. So as does licensure exam, ideally, is a mannequin-based kinesthetic assessment, a non-patient-based OSCE, and a portfolio of comprehensive patient care. Not using human subjects in a live testing scenario, and it's valid and it's reflective of the current scope of dental practice. Also universally accepted so that students don't have to say, well, I need to have a different licensure test if I want to practice in this state versus this state. Great, so thank you, and I will now pass it off.
Hey everyone, so I'm going to talk about the next topic, which is microaggressions. So just to give an introduction, what is a microaggression? So the definition is it's a brief and commonplace verbal, behavioral, or environmental indignity, whether intentional or unintentional, that communicates anything that is hostile, derogatory, or negative, and it can have potentially harmful or unpleasant impacts on a specific group or person. It can be a statement, action, or incident that basically is against a member of a marginalized group, such as racial or ethnic minority. It could be on the basis of income, race, social, capital, religion, gender, immigration status, sexual orientation, or other characteristics. Move to the next slide. So some examples of microaggressions. You speak English really well to someone that was born and raised in the US. Are you a nurse to a female physician examining a patient? You're so articulate, or you speak so well to a colleague of color, or wow, you sound very masculine to someone that is self-identified as a gay man. Next. So different forms of microaggressions, there are 3 types. Verbal, it's a comment or question that is hurtful or stigmatized to a certain marginalized group of people. An example would be, you're so smart, for a woman, that's a verbal microaggression. Behavioral is behavior that is hurtful or discriminatory to a certain group of people. Environmental is a subtle discrimination that occurs within society. One such example would be a college campus that only has buildings named after white people. And there are 3 types of microaggressions. Micro assaults Microassault is when a person intentionally behaves in a discriminatory way while not intending to be offensive. One such example is a person telling a racist joke, then saying, "I was just joking." Micro insults are comments or actions that are unintentionally discriminatory. For example, this could be a person saying to an Indian doctor, "Your people must be so proud." Micro invalidations are when a person's comments invalidate or undermine the experiences of a certain group of people. An example of that would be a white person telling a Black person that racism does not exist in today's society. Next. So lastly, I just wanted to talk about how microaggressions harm people. Research has shown over and over again that microaggressions, although they are seemingly small and sometimes innocent offenses, can take a real psychological toll on the mental health of the recipients. This toll can lead to anger and depression and can lower work productivity and problem-solving abilities, especially in the workplace.
And next we have barriers to care, which we'll be talking about. So barriers to care describe anything that prevents people from receiving adequate health care. So that includes like finances, location, transportation, health needs, or poor oral health literacy. And some compounding factors to this might include like language barriers, education barriers, and cultural barriers that increase these difficulties or already difficult situations, like being in an area with not many healthcare providers in general. And here's a little figure that will be in the next slide as well, if we want to go to that one. Okay, so some consequences to barriers to care, just a very brief overview. They can leave patients with serious conditions that threaten their overall and systemic health and quality of life. And as of September of 2019, almost 7,000 dental health professional area shortages were accounted for, which means we need almost 10,000 more practitioners to meet this overwhelming need of like not enough practitioners in the area to help the need. If we want to go to the next one. Okay, so ASDA has done a few things to help and adopted some policies for this. They've encouraged students who are interested to take action through projects, education, internships, externships to reach these underserved populations, and also having encouraged evidence-based solutions for these barrier to care things, such as early intervention, Medicaid expansion, and co-location of health services. So that means you could have more than a one-stop, well, you could have like a one-stop shop. So an office with many healthcare providers so they could address many needs at once rather than having the transportation to reach a bunch of different healthcare providers. In addition to that, ASDA has helped progress certain health acts, the Dental Health Act, and has continued support for ELSA, which is Ensuring Lasting Smiles Act that helps children with deformative congenital abnormalities to make sure that they receive the care they can, even in areas with health shortages. So that wraps that one up.
Okay, thank you guys so much for giving us a little background on that. What I'm going to do right now is I'm going to open the breakout rooms. If anyone kind of joined late before I started sorting them, I will put you into one. And for some people, you might be like 2 right now, but don't worry, I'll put more people in. Every group should have a facilitator, at least one. If there's 2, that's okay as well. And just because we're running a little short on time, instead of doing 4 minutes in each and coming back, we're just going to stay in the groups for like 15 minutes. So you have some time. I can broadcast when it's recommended to move on to each topic, and just hope you guys have a good conversation. And so with that, I will be opening the breakout rooms.